Hello dear viewers, in continuation of this series on ventilator graphics, in this video which is part 3 on ventilator graphics, I will be discussing loops and their importance in the management of critically ill patients, those who are on mechanical ventilation. I am Dr. Sunil Garg from Essentials of Acute Care. In my earlier video, which was part 2 on ventilator graphics, where I discussed about scalar waveforms. As we know, scalar waveform is created when one of the variable is plotted against time on xy axis and variables are either flow, pressure or volume. But loop waveform present the relationship between two different respiratory variables plotted on an xy coordinate system, offering a dynamic view of the mechanical ventilation process, and it is not plotted against time. Specifically, loop graphics illustrate either pressure or flow against volume, providing insight into the interaction between these variables during the respiratory cycle. Each loop waveform consists of the inspiratory and expiratory curve. When these curves are graphed together, they form a distinctive loop shape which is the basis for the waveform's name. The primary type of the loop graphics are either flow volume loop and pressure volume loop. These loops are invaluable for diagnosing and monitoring changes in the respiratory mechanics, allowing clinicians to visually assess and adjust the ventilator settings to optimize patient care. This is flow volume loop. The flow volume loop is a graphical representation used in both mechanical ventilation and pulmonary function testing to visualize air movement into and out of the lungs throughout a respiratory cycle. This tool is crucial for diagnosing obstructive or restrictive lung diseases. In a typical flow volume loop, inspiration is depicted on the upper part of the graph, showing air being drawn into the lungs. Expiration is represented on the lower part with a curve returning to the baseline to complete the loop, symbolizing a full breath cycle. During mechanical ventilation, the shape of the loop provides insight into the pulmonary mechanics. For example, in patients with the obstructive lung disease, the peak expiratory flow is reduced. You can see here in comparison to this normal graph, the peak expiratory flow is reduced, leading to a characteristic scooped out appearance of the expiratory limb. Additionally, the graphic can indicate air trapping, a condition where air remains in the lungs due to incomplete exhalation. Here you can see this expiratory limb is not returned to the baseline at 0 point. This phenomena is identified when the expiratory limb fails to return to the baseline, suggesting residual volume in the lungs post exhalation. This is pressure volume loop. Pressure is shown on x-axis while volume on y-axis. The pressure volume loop is a ventilator graphic illustrating the relationship between lung pressure and volume during a respiratory cycle. A standard pressure volume loop trajectory ascends counterclockwise to form a complete loop. It highlights critical inflection points that indicate rapid changes in the curve slope. This is lower inflection point and this is upper. The lower inflection point signifies the opening of cleft alveoli marked by a notable volume increase. You can see here till this lower inflection point there is more changes in the pressure than volume, but beyond this point volume increases rapidly with much less changes in the pressure, which signifies opening of the cleft alveoli. Conversely, the upper inflection point is observed near the end of inspiration where additional pressure yields only marginal increase in the volume. Loop B illustrates the phenomena of overdistension within the pressure volume loop. Over distension, a risk of lung injury occurs when the lungs are subjected to excessive volume or pressure. Here you can see rapid increase in the pressure without any significant increase in the volume. Under normal circumstances, a pressure volume loop resembles a football shape. A flattened curve means curve shifting towards the right suggests reduced lung compliance, while a steeper curve or shifting towards the left indicates enhanced compliance. A broader curve signals increased airway resistance and a narrower loop suggests lower resistance. Here I finish. Thanks for watching this video. Hope this video will help in understanding the respiratory mechanics during invasive mechanical ventilation. If you have any feedback, suggestion or comments, please write them down in the comment section. See you in my next video on ventilatory graphics part 4. Till then, bye and take care.